Welcome everyone. Dr. Mandell here with you. Hopefully you're having a pleasant day or night. Hopefully you will be enjoying this particular program. This is all about carpal tunnel syndrome. Many great fast natural relief techniques and tips I'm going to give you that's really going to give you a jump on helping this condition. Realize that many of these conditions of carpal tunnel syndrome, of pain, tingling, burning, waking you up at night, your hands just feel like it keeps going to sleep. Your grip strength keeps getting weaker. You've been to doctors. They want to do surgery on you. You've been on anti-inflammatories. You've been on medication. It's getting you sick. You're frustrated, or you've even had 1, 2, or even 3 surgeries, and you're still having problems. Now realize just being overweight can cause irritation and pressure on that median nerve. So realize there's a lot of different factors we're going to review. I'm going to go through it pretty quick. Women who go through changes in hormones, pregnant women, diabetics, people who have neuropathy, old injuries, even conditions coming from the neck, because the nerves in the neck do control all the way down the arm into the hand. People who have radiculopathies can affect carpal tunnel syndrome. Why? Because the nerves control the vessels, it controls the muscles, it controls the arteries. Everything is being controlled. Let's move forward. A lot to say. Let me move real quick so we can get through this. You can see the difference between a normal carpal and a compressed carpal. We're looking at the transverse carpal ligament that runs across the hand. When that carpal ligament compresses on that nerve, we then start experiencing tingling, numbness, pain, and the pain can go down the arm, or we could say back up to the arm to the neck, or it can actually go down into the hand and the fingers. Now, I want to go over something that's important. People say, I have carpal tunnel over here. No, you don't have carpal tunnel. Carpal tunnel does not affect that little finger. It does not affect the outside of the fourth finger. If you see where the nerves of the median nerve affects, it affects primarily the thumb, the first 3 fingers, and part of that fourth finger on that thumb side. So generally, we're going to usually feel numbness and tingling in this area, okay? A lot of times we may notice that the thenar eminence right in here can start to atrophy. In other words, the muscles start to become limited. If you look at your hand, you compare it and you say, wow, this muscle is really starting to disappear. You need to get that looked at early, because the earlier you get on this, the quicker you're going to get the recovery. Now realize that surgery is not always the answer, because once you go in and decompress the median nerve, you're leaving scar tissue. The scar tissue in itself can cause lots of issues as well. Here's another issue, another angle here. You can see the issue there on the median nerve, just where that median nerve comes through underneath that flexor retinaculum. And then here we can see again that transverse carpal ligament, how it covers that nerve, and again where those nerves go to. Okay, now you notice up top there, you see the flexor tendons. The first thing I'm going to tell you to do, if you have carpal tunnel syndrome, you want to move these flexor carpal tendons. So the first exercise you're going to do is you're just going to make a fist, and you're going to open it up like this. And as you open it up, I want you to kind of imagine as you open it up that you're shaking, that you're shaking everything out of your fingers. So this is what it's going to be like. You're going to close the hand. Now notice when you close the hand, put your fingers, your other hand of your fingers on the front part of your wrist here, okay? I want you to do this. Now just open and close the hand, okay? Now you can feel those tendons moving, because every time you open your fingers, the tendons have to glide up and down inside that carpal tunnel area. So the first exercise, we're going to do this, open it up, and as we open it up, shake it side to side like you're pushing it out of the fingertips. It's what it's going to look like this, and like this. Okay? You'll do that about 15 times. So you're going to close it, open it, and shake it. And that's going to stimulate the area, bring more blood supply to the area, help free up the tendon, because the tendons, when overworked, if you're doing a lot of typing, particularly when your hand is flexed backwards or actually flexed forward, if you do this, go ahead and do that. And you notice as you hold that position about 20-30 seconds, if you start to feel tingling or numbness in here, you're affecting that median nerve. That's called Phelan sign. Okay, this is called Phelan sign. As you flex the wrist, and if you do this, you say, you know what, I don't really feel anything. You probably don't have carpal tunnel. You could just have a tendonitis, inflammation in the area. Let's move forward. Primarily, a lot of people that even use mouses. Very common, using the mouse, because you can't have your hand in this position like this for long periods of time. You start compressing on that median nerve. You don't want it flexed down. You want to keep it neutral. And the reason why you want to keep it neutral is so you can allow it to breathe. You see that splint right there? There's a lot of doctors, and I see other doctors or even therapists coming on YouTube and talking about knocking these support braces. I cannot knock it. Why? Because it helps you keep the wrist in neutral. You got to keep that wrist in neutral plane. If you're going to go to sleep, you're going to be like this, you're going to keep compressing on that median nerve. Keeping it neutral plane is good. If you can work in neutral plane, it's even better. So that gets back to ergonomics, proper height, proper positioning of your wrists. A lot of times you have the ergonomic little humps in front of the keyboards that you can sit it on to keep your wrist straight. There's a lot of different things, and I don't want to have the time to go over this particular program, but just keep that in the back of your mind. Ice. Every person should be icing. Ice several times a day. You want to reduce the inflammation. That is the key. And I'm going to give you some other tips on how you can do this. Chiropractic adjustments are extremely good in manipulating to mobilize the area because of the fact we have the scaphoid and lunate bones up in here. And when those joints sometimes subluxate from keeping our wrist in extension, you can irritate on that nerve. I have attached a carpal tunnel self-correction adjustment you can do on yourself. All right, I attached it underneath in the description, so I need everyone to look at that video. That can help do wonders for you, just that adjustment. That's something I attached. That was a previous video I did not too long ago. Here are some great natural anti-inflammatories. I love turmeric. I like ginger. I like quercetin. I like boswellia. I don't have them all here. I love pineapple, bromelain, raw apple cider vinegar, excellent for inflammation. Omega-3s, everyone out there should be having at least 2,000 milligrams of omega-3s a day, maybe 3,000. You need to bump up those omega-3s. Omega-3s will reduce the inflammation tremendously, not only in your wrist, but through your whole entire body. It's helpful, very, very helpful. The other thing I wanted to mention, vitamin B6, the studies are out there in vitamin B6. Vitamin B6 is wonderful. Vitamin B6 will help relieve nerve pressure, which is associated obviously with carpal tunnel syndrome. And a big tip, because research shows, adding manganese. Not magnesium, but manganese. Now, magnesium's still good. Magnesium will relax muscles. Magnesium does relax smooth vessels. It will relax, there's no question. But manganese, primarily about at least 100 milligrams of vitamin B6 and about 5 milligrams of manganese taken daily can help you. But manganese has been shown to be helpful with B6. I thought I would share that. The other thing, let me see what else here. So we got turmeric. Black seed oil. Black seed oil, check it out. Check my video on black seed oil or Google it. You can see other videos out there. Black seed oil is wonderful when it comes to reducing inflammation, and a lot more benefits than that in itself. Let's move forward. Some great natural inflammatory essential oils. You can see there frankincense, myrrh, eucalyptus. I like using the eucalyptus and peppermint, as well as lavender and wintergreen. You can be creative. You can take a couple drops. You can actually use the oils with almond oil. You can use it with coconut oil, olive oil, argan oil, rosehip oil, jojoba oil, apricot kernel oil. You can mix those oils, those essential oils, with those other oils. You can actually take, by the way, cayenne pepper, my favorite. Great anti-inflammatory. It's amazing. You can be creative. You can put it right on the surface. It will help penetrate. Those, as well as frankincense, great natural inflammatory, will really help reduce inflammation. Don't be afraid to use the oils. They can do wonders for you, and they are extremely safe. Another thing I want to mention, let me just go on back to here. Excuse me. Okay. Another thing I want to mention to you that has been very effective in carpal tunnel syndrome, light therapy, infrared. Infrared, you get very cheap infrared lamps, infrared bulbs. You get them for $10, $15. You get them at warehouses at your Home Depot or your supply store. You can go to Amazon and get them for 20 bucks. These little miniature portable, they have near and far infrared. I think these are far infrared, but infrared is healing. And it's amazing. You don't want to put it on there where it burns you, but you want the light to heal. The light heals the cells, repairs the cells, allows the mitochondria to start to heal. That's what healing is all about, from the inside out. So don't be afraid to use light therapy. No one talks about light therapy. All right, light therapy is extremely beneficial in healing for all inflammation of the body, bursitis, tendonitis, and basically when you have carpal tunnel, it's tendonitis, it's inflammation, it's swelling. But don't be afraid to use the ice. The more you use the ice, the better you're going to feel. Now, obviously, there's a lot of drugs that doctors will recommend. The anti-inflammatories, we're looking at the things like the I don't want to go into the names, but basically we're looking at the non-steroidal anti-inflammatories that can really mess up your liver as well as your kidneys. So be very, very careful. Remember, proper bracing and support is really important, particularly if you're sleeping. If you don't wear it during the day, keep the wrist in a neutral plane. Wrist strengthening is also good. You can actually just take a little 1-2 pound weight, let your wrist hang. You could do extensors. You can do radial deviation. You could do ulnar deviation just to strengthen the area up. But you need to watch the habits, the things that you're doing day after day. You don't want to keep an extension. Get a good ergonomic keyboard. I think will really do a lot of good for you. Any last things I want to mention to you? Let me just double check. I think I've hit the most important thing. But these conditions, you got to be aggressive. Check out that video I put below. You're really going to like that. It's a little simple adjustment you can do on it because of the fact that the majority of this world has misaligned or dislocated carpal bones. We have 8 different carpal bones in our wrist. And if these carpal bones shift or misalign, it can affect those nerves and affect the function, the normal biomechanics of the wrist. I hope this information does you a lot of good, but this is all about prevention. Don't jump into those injections of steroids, and don't let the doctor scare you. Do the right thing for your body. Your body is always trying to heal every single day. In our chat room, I want to thank our chatters out there sharing some great information as well to our other chatters. But if you have not subscribed to my channel, please do so. Why? You're going to learn. I'm here to help, to give, to serve, and to see good things humanity. So share this video on your social media. I think it would help other people as well. And most important, I just want to mention one thing. Don't ignore symptoms. That's Mother Nature's way of telling you something's going on. And the longer you ignore them, the more problems and the harder it's going to be to correct. Anyways, I wish everyone out there many blessings to you and your family. Stay proactive. Continue watching the many hundreds of videos on my channel. Great self-help videos as well as nutrition. Blessings to everyone. We'll catch up with you in our next video. Bye-bye now.